Well, many of people have experienced tough times during the pandemic while also struggling with mental health. And to cope, some will turn to various substances. And unfortunately, this could result in overdosing or possibly death. Our Nixon Norman has more on this increasing issue.
No matter what your age is, no matter what stage of life you are, the pandemic has affected everybody.
According to the CDC, drug overdose deaths were up 35% in Alabama in 2020, which was the year the pandemic officially started. And because of the pandemic,
there are fewer ways to manage stress these days, especially in times of social isolation. So people are resorting to more alcohol and substance use as a way to cope.
And according to the Alabama Department of Mental Health, between 2018 and 2020, approximately 2,500 Alabamians lost their lives to drug overdoses. And it seems as if this trend is on an upward slope.
People presenting to the ER with overdoses has raised exponentially, has gone up. That's been one of the biggest worries that as psychiatrists working in the inpatient and the ER we are facing.
One reason for this increase is quite simple. More people are spending more time alone.
People are living alone and they're overdosing on medications. We don't have anybody to call 911. That's been a huge issue.
Other cases may involve the mistreatment of or the accidental overdosing of prescription drugs.
People overdosing on opioid medications, on benzodiazepines, that has gone up so much.
But with more and more physicians concentrated on addressing the pandemic, there are less physicians addressing this issue. And although it's not ideal for many, treatment for mental health and substance abuse concerns may be shifting in a more online route, especially if we continue to see new variants and surges.
So obviously, access to mental health care at the primary care level has gone down. And that's one of the reasons why telehealth is going to play a big role in addressing this crisis.
Nixon Norman, Fox 54 News.